around 2005, I noticed that there was a really strong trend toward trying to identify the shooter as mentally ill, assuming that the shooter must be mentally ill, and then there would be this sort of retroactive surge in the media searching into the shooter's background, searching into their motivations, sometimes looking at just the tiniest details of their lives. And it was all this effort to kind of paint a picture of a madman, basically. Now, what's wrong with that is that it ignores the really obvious risk factors. Someone who's white, someone who's male, someone who's alienated, someone who has really easy access to weapons. And if the person is mentally ill or has mental health issues of some kind, often what you find when you look into their pasts is that they've tried to get help and the help that they've gotten has not been sufficient. So when I was researching Virginia Tech, for example, one of the things I found was that Seung-Hui Cho, the shooter, had tried to access mental health care. And he encountered exactly what I had encountered when I was a student trying to access mental health care, which is really long waits, being treated really impersonally, and then not being responded to in a respectful way. It's not something that you can really point the finger at any individual university or even any individual person or office at a university. It's really a systemic problem. We need to stop thinking of these as sort of individual lightning strikes kind of incidents, and instead look at the way that people who are struggling with mental health issues in the university are inadequately supported. They're stigmatized, they're afraid to speak out. I've done actually quite a bit of research with both students and professors in different academic settings. I've actually interviewed dozens of professors at many different universities. Almost all of the professors with mental health issues are afraid to say anything. They also can't even figure out where they would go to access services. So much better supports for mental health care for students and faculty is one of the systemic changes that's needed. But along with that is an attitudinal change. Still, research shows, in-house studies, large national studies like ones that I've conducted, it still shows that not only are mentally ill people in universities afraid to say anything, but they're really regarded with disdain. There's still a lot of stigma attached to it. And so, going back to the school shooting issue, it's not that an individual person is just sort of inevitably getting crazier and crazier until they snap. Really, these incidents are a symptom of a system that doesn't provide adequate support for stressed people and marginalized people across the board. The issue that I had noticed was university spaces were trying to accommodate physical and sensory disabilities. For example, it's not unusual to see a ramp leading into a building. It's not unusual to see an interpreter, a sign language interpreter at an event. So these kind of accommodations are visible and happening in university spaces. They're not perfect, but they are happening. What I had noticed is that there was no visible, at least not that I could see, accommodation or attention to mental health issues. And the more I looked into this, the more I realized that not only were university spaces kind of skipping over mental disability, they seemed to be almost actively rejecting it, actively pushing it away through using terms like wellness, resilience, and you can even go back to sort of traditional sayings such as a sound mind and a sound body, or the valorization in higher education of agile minds, quick minds. We're kind of all here to work our minds, right? So that was something I was really concerned about. And I wanted in Mad at School to talk about that kind of pushing away of mental disability that I saw, but also to talk about some practical ways to respond to it. How do you make a classroom more accessible for mental illness? What would that even look like? What would that mean?